Welcome to Patients at Risk, a discussion of the dangers that patients face when physicians are replaced with non-physician practitioners. I'm your host and the co-author of the book, Patients at Risk, The Rise of the Nurse Practitioner and Physician Assistant in Healthcare, Dr. Rebecca Bernard. Physicians train for at least 15,000 hours before we are permitted to practice independently. And one of the reasons is because it takes a long time and a lot of patient volume to learn how to recognize emergencies when they occur, especially when they need immediate intervention. Today's guest brings us a perfect example of the importance of this training. Dr. Karen St. Singh is a veterinarian, and she's here to share her story of experiencing compartment syndrome, a life-threatening medical condition. Dr. St. Singh, welcome.
Thank you for having me.
And to help us better understand the medical implications of this condition, we are joined by trauma surgeon, Dr. Stephanie Markle. Dr. Markle, thanks for being here.
Pleasure to be here.
Karen, start us out by telling us a little bit about yourself. You're a small town veterinarian, right?
Yep. So I'm a solo practitioner, mixed animal, mobile, pretty much do everything, food, animal, and fibers, what I specialize in, and do it all out of my truck and by myself. It was a Friday. I'd worked that whole day and not done anything super strenuous. The last thing I did for the day was put a orogastric tube in a goat in kind of a little weird shed in it, but I didn't see anything on my arm that indicated a sting. The next day it just kind of really hurt, kept on hurting, and I finally told my husband, I was like, I need to leave, we need to go to the urgent care now.
Now, what was it? So you put a tube down a goat's throat, and I'm sorry, I laughed a little bit because I got a mental picture of that, although the poor goat. So you put a tube down, and what was it that started hurting afterwards? Your hand?
It actually didn't hurt afterwards. That was the last thing I did, and I thought maybe, hey, this is what, I put the most, recent thing and correlated it with.
So you felt perfectly fine that night, and then the next morning you woke up and
probably the next afternoon, the arm in general, but if I tried to spread my fingers, which I now know is one of the classic signs, it really hurt. It was something I knew that this is getting worse throughout the day. It's not getting better, and I couldn't open my fingers. And so I went to the urgent care, explained what was going on, showed her. And I even specifically asked about compartment syndrome. I don't know why. I still have no idea why. I'd been reading some strange diagnoses and misdiagnosed books. I specifically asked, and I was told no, absolutely, there's no way it could be that.
Karen, let me stop you because I don't know too much about compartment syndrome. I'm going to have Dr. Markle fill us in, but did you have any kind of redness? Was your hand swollen, or was it simply that it hurt a lot?
It just hurt a lot with absence of no trauma, no wounds, nothing.
All right, Dr. Markle, fill us in. What is compartment syndrome, and is this an easy diagnosis to make? And what do you think when you hear this story?
It is usually a difficult diagnosis to make, especially in the setting without trauma. Obviously, if there's trauma, the diagnosis becomes a little bit more likely, but the real big signs are usually, the first one is pain, and it's pain out of proportion. So you would look at your hand or your arm or whatever the area is that is involved, and it doesn't look bad to the visually, but the pain is excruciating. So that is usually any time of pain out of proportion, in my opinion, and any physician, I think it's always a red flag somewhere in the back, okay, something is clearly going on. This is not normal. And then I usually find that the pain with passive motion, so if I would try to move your fingers open or close your hand or move any of the muscles, it would also create more excruciating pain. So that's the first classic sign. There are 5 more, but pain is the first. And as you move down the gradient, then they get worse and less reversible.
What is compartment syndrome?
So your muscles are basically encapsulated in this compartment surrounded by fascia, which is the covering that sort of surrounds your muscle compartments. And each section of the body has multiple compartments, some more than others. And then when you have sometimes like trauma, broken bone, or excessive muscle use. So you could do, I don't know, excessive squats or something where you're doing repetitive motion with a certain set of muscles. That muscle then becomes essentially injured, even though you didn't traumatize it with a machine or an injury. And then the muscle itself will start to swell. And because it's sort of locked into a compartment, it doesn't have anywhere to go except for it sort of squeezes on itself. Therefore, it decreases the blood supply within that compartment. So the little tiny capillaries in your muscles start to have less and less blood. So that's why then you get the pain first from the swelling, then the decreased color from the decreased blood flow. Then you get numbness and tingling, like when you feel like your limb is asleep because you slept on it funny, and then all of a sudden you're like, oh, just the pins and needles everywhere. But then you release whatever it is that was putting pressure on it, and you can feel blood flow return, and you get that sensation back. That essentially is also what's happening, but on a little bit different scale. You also will get it, it'll be cool to the touch, because again, it has to do with blood supply, and our blood is obviously a body temperature of 97 degrees. And when you have less of it, you will get cooler. And then because it's affecting the nerves with too much pressure and not enough blood supply, you basically will have ischemia, or an insult of everything, and that will end with paralysis.
Wow. So very
muscle,
very serious. So you could lose your arm, and potentially even worse, right?
Yeah, you could lose an arm, a leg, a hand.
I guess you could die if it didn't get treated properly, I would imagine.
Yes. And I mean, you can even get compartment syndrome of your abdominal cavity, of your chest cavity. I mean, usually that's from, burns or other situations, but essentially any compartment in your body can develop a compartment syndrome. Extremities are the most common.
Well, it sounds extremely painful. So Karen, you were at the urgent care, and you even brought up, like, could this be compartment syndrome? And the nurse practitioner was like, absolutely not. What did she think it was?
She thought it was a sprain. I was like, okay. And she put me in a sling and said, don't use it, have fun, and set me out the door. I think they gave me a Toradol injection because that's apparently
something for pain, anti-inflammatory.
Yeah,
so she sent you out the door, and then of course it started getting worse. So at a certain point you were like, I got to go to the emergency room. Fortunately, it sounds like you had a really amazing emergency physician, a small town ER doctor. And you said that he actually knew what it was right away.
Yeah, he did. You could look at him, and he kind of looked at my hand first, is what he noticed, that I couldn't open it. It was kind of all scrunched up, kind of like when your hand's in the glove that's too tight. And as soon as he looked at me, I could just tell, I've had that thought before, like, I know what this is. And, I've never seen it before, but I know what this is.
Like that clinical acumen where like that light bulb just goes off and you're like, right. Oh crap, this is something that I've never seen, but I know I have to watch out for.
He went ahead and got, things done like blood work and x-rays and things that he knew that weren't going to really help, but were going to help reduce the amount of time while he was on the phone with the, I call it a referral hospital, but the university hospital. And once he got all that done, that's when he came and talked to me and said, this is compartment syndrome. You need to go. There's nothing we can do for you here. You need a hand specialist, and you need to go now.
It's so interesting, Karen, that you say that he even said to you that he had never seen one of these before, and this was like a doc who was pretty experienced.
Yeah, he was an older doctor, one that's been around a long time.
I've never seen a case of it in my career, but Dr. Markle, you've seen lots of cases of this because this is what you do, and you get to see these. Talk to us about how common this is, how hard it is to diagnose, and what do you actually do if you have a patient that you suspect this condition in?
Especially in your setting, Karen, where there was lack of trauma specifically, obviously the diagnosis, I think, is even harder to make because that history, as we all know, is so important. It's usually 90% of your diagnosis is made just in the history and how you describe it. So I think with the pain out of proportion is the red flag every single time. And the hand especially, they're very small compartments because the muscles are very tiny. So it doesn't probably take very much to cause compartment problems. I also had one in somebody where she had an IV in her arm and the IV infiltrated. So it was no longer in the vein, it was sort of in the tissue. And they were running a pretty toxic med through that IV. And until they recognized what happened, I mean, it was pretty quick, but they pulled it out and then, the hand swelled and everything and lost
Stephanie,
pulse.
on a side note, I'm just going to interject one thing. I see all these
Yeah.
people doing these IV infusions like, oh, you're going to be healthy. We're going to give you vitamins. And people get mad at me because I criticize it and they say, well, what's the harm? Compartment syndrome.
Yes. I mean, I literally had a 26-year-old who lost part of her thumb and some of the function of her hand as a result of this IV that went poorly. Luckily she's 26 and everything is okay, and you can do okay with missing a piece of your thumb, but it's a body part. You were born with it. You should keep it.
And to go through that for a treatment that's completely unnecessary, not medically indicated, just because supposedly this myth that you're going to feel better, which isn't even true. It's very infuriating. So thank you for sharing that.
Yeah. And I think once there's a way to physically diagnose it, but most of the time when I see it, I just assume that's the diagnosis and move straight to treatment, because the academic aspect of making the diagnosis, you'll see it when you perform the treatment. So you can use pressure monitors and actually take needles and put them into the compartment and measure the pressures. So that's one way to diagnose it, or you just open the compartments surgically with a knife. And that will also, the muscles will bulge out. It gives it a place to go and it allows the blood flow to return. And then you just have to deal with wound care after that. But that's now you'll still have hand function, motor activity, and the one thing I forgot to mention earlier was that you can lose a pulse. So you'll actually lose your pulse before the paralysis. So either when you lose a pulse, real bad, and obviously and not being able to move it also real bad, and both of those are usually irreversible or getting really close to the point where if you don't intervene, there will be permanent damage.
So it sounds like what the ER doctor had to do, number one, suspect compartment syndrome. That's the most important thing. And then number two, start getting on the ball as far as getting you transferred to the appropriate place where they could actually perform that surgery. And so he's on the phone coordinating, giving the report. He starts getting blood work and stuff like a pre-op kind of a workup, it sounds like. Now, Karen, talk to us about the thoughts that went through your head, because you were terrified naturally. What were you feeling in this moment?
Well, I knew what compartment syndrome is just because of my medical training. We get it a lot in animals in their abdomen, like Dr. Markle was talking about. So, but I knew what that was, and I knew that there was a good chance that I might lose my arm. And so my biggest factor or thought process was, what am I going to do? Because, I love what I do, but I really like doing food animal, and that's what makes me whole. And so my first concern was, how am I going to maintain my mental health and do a job I trained for years and I'm in severe debt for, and still enjoy my life. And so I was like, trying to think of different jobs that I could do. Like, I could go out west, but I'm gonna have to move and go out west where there's like, stockyards where I could do, or huge dairies, and just do palpation with one arm.
Wow. So you're really like rethinking, like your life's flashing before your eyes, and you're already like trying to plan your future with just one arm. And thank God it didn't come to that. The doctor had your husband actually drive you right over to the hospital because he felt it was going to be faster than waiting for an ambulance. Cause I guess how far away are you?
We're about 2 hours.
Oh, yeah.
2
So
hours.
by the time they send them from that place to you, it makes sense. So you just got right over there, 2 hours. This is where we always hear about like rural care, but here you had in your small town, this very astute, thank God, physician that knew what needed to be done. You got over there and you said that they were so on the ball, like they knew what was going on. They brought you right in, and that even the surgery fellow just pushed you right from the bed into the operating room without waiting on nurses or anything.
That was kind of the most like unnerving part for me, was that I'm sitting here with people that are dying from strokes and heart attacks and motor vehicle accidents and things like that. I'm in the same ward as them and I have an ouchie arm, that's what it looks like. And so I'm sitting here just kind of holding my arm, very, very painful, while there's literally the person next to me was having a heart attack, and 2 things down was having just got like a motorcycle, was on a motorcycle and got run over by like 2 cars or something. And so that was probably the most unnerving part. Because of that, it did take a little while for me to get back, but as soon as the orthopedic hand fellow came in, he literally took me right back. There was no, I was really amazed because I had more than one surgery while I was there, and I was really amazed at how different those experiences were, because like he took me into pre-op and was there. It was just me and him. That was it. There was no nurses, no anesthetist, nothing. It was me and him. And then they didn't he didn't have me undressed or anything like that, and took me straight into
You just got right down to business.
And so like the next time I get there and they're like, okay, you need to undress now. And I'm like, well, I didn't have to the first time. So,
now, Stephanie, this is like, you're a trauma doctor. So is this pretty common where, I guess my point is to ask you, when you look at all these sick people, they're all sick, but there's a triage, and you as a physician, you have to look past what superficially looks really bad and really hone in. Talk a little bit about what that's like as a physician.
Yeah, I think that's actually the hardest thing to teach, and I think is the part that comes with the most experience. I mean, I really just want my interns after their first year to be able to look into a room and be like, is this patient sick or not sick? And like, that's it. Like, that's all I expect. And that's just after a year of all they do is seeing patients, right? So I think as you sort of move through training, that's really what you pick up on is, even though some people, yeah, you have a bone sticking out of your leg and be bleeding, but I was like, this is, your compartment syndrome is more time sensitive than the bone sticking out the leg. So there's definitely experience that comes with understanding the disease process, what's going on, and why intervening as soon as you can to sort of prevent the long-term sequelae and complications is so important. Obviously, a lot of what I do is urgent, emergent, more timely than elective. I too have wheeled patients straight from the ER into the operating room, and that understanding who is the one that needs the attention first, that is truly the only thing that can come from experience. And there's nothing other than just doing it and seeing thousands of patients over a course of 7 years of training.
That's why there's no shortcuts, because
No.
it just takes that amount of time and that volume until you've seen enough of these and you can do that, or even just to think about something that you may have never seen before, but it's in the back of your mind because at some point you learned about it. So
it's so hard too, because in our training, there's so much graduated training. So you have like your intern and your junior resident, your senior resident, and then you get to me as the attending, and I'm there to make sure that everyone is in their appropriate level and doing things appropriately for their level of understanding. And it's very interesting to see the different decisions that a first year resident makes versus a 5th year resident. So training matters.
100%. Well, Dr. Singh knows that for sure, because thank God for all of that. And fortunately, although you had to have a couple surgeries, and I understand you have a lovely scar, but now you say that you actually were able to get back to work and you delivered a calf and pulled it out, which you weren't sure if you weren't going to be able to do that again.
Yeah, I was so happy that day, because I was out for about a month and a half or so from work. And then when I went back, it was hard going back because I still was having to do a lot of exercises. When I finally got back and was able to pull that calf, I was so excited, and I took pictures and sent them to the hand surgeons and everybody because I was so excited. I'm sure they weren't quite as excited, but I was.
I guarantee you they were absolutely like, these are the types of things I think that make doctors,
Yeah.
it makes it all worth it. All those years that Dr. Markle was in training, it's so that she can save someone's arm so that they can save someone's calf. I mean, and so on, and live their best and fullest life. And I want to thank you so much, Karen, for sharing your story, because what you wrote was that you wanted to bring light on the work that is being done in small town emergency rooms across this great country of ours, where we may not have, hand surgeons and all the technology, but if you have an astute clinician, a physician with the right training, you can get to the right place to get to the right care, no matter where you are in the country.
We're really lucky to have what we do, and we're really lucky that it's staffed by physicians and that are knowledgeable in care. And all you ever hear about with things are the bad things, I feel like. And I really had just gotten tired to that point where I was like, y'all need to stop, just take a break, take a step back, and just think about how lucky. What if they weren't there? If they weren't there, I don't know if I would have went, and I don't know if I would still have an arm today. I just don't know.
Well, I thank you so much for speaking out about this, not only to give credit to the hardworking emergency room staff, but also as a warning call, if you can say that, to everyone out there to really make sure that there is a physician staffing your emergency room. That might be something to even look into, because increasingly corporations are replacing physicians with non-physician practitioners in an effort to save money. Usually they'll say they can't find a physician, but generally that's not true. Generally, they just don't want to pay what it takes to get a physician. They want to cut corners. So advocate for yourself, make sure that there is a physician available to take care of you, because I always say one day I'm going to look up from a gurney and I want to make sure that there's a doctor there to take care of me. And I think that's what all of us deserve to have. So thank you so much, Dr. Karen St. Singh, Dr. Stephanie Markle, for joining me for this really important conversation. If you'd like to learn more about this topic, I encourage you to get the book Patients at Risk, The Rise of the Nurse Practitioner and Physician Assistant in Healthcare. It's available at Amazon.com and at BarnesandNoble.com. And if you're a physician and you'd like to learn more about getting involved in our mission, which is to advocate for physician-led care and truth and transparency among healthcare practitioners, please join our group. It's called Physicians for Patient Protection. Our website is physiciansforpatientprotection.org. Thanks so much, and we'll see you on the next podcast.